So my talk today is going to be about the vagus nerve. Can it revolutionise well-being? You may have heard the vagus nerve talked about more and more recently. It does seem to be a popular topic. I think the main reason for that is because it could actually revolutionise our well-being. I'm very excited, and the more I read and the more I find, the more excited I get. And so this talk is just going to give you a bit of a general overview and maybe help you think about whether it's something you want to progress for your clients in your practice. So here's my contents. So first of all, I'm going to start with a little introduction and why I started working with the vagus nerve, a little recap on anatomy and physiology of the vagus nerve, a touch on polyvagal theory, what is vagal tone and how can it be measured, the benefits of improving vagal tone, gentle release therapy and the vagus nerve, a couple of case study examples and how you can improve your own vagal tone. How it came about. So gentle release therapy had already helped my autistic daughter, but she was still struggling at school, and I thought, let's try working on the vagus nerve. So we got into bed and got all snuggly, and then we were looking on YouTube for videos about the vagus nerve, and so we started doing these stretches and massaging down, and anyway, she soon got bored and said, I don't really think it's doing anything, so off she trotted. And then I thought, well, what am I messing around doing other people's things for? Why don't I just do gentle release on the vagus nerve? And I did, and I had a really big release. So my body reacts when energy is released, so I knew that I was on the money with that. So carried on doing mine, carried on doing Imogen's, and over the next couple of months actually things did massively turn around for her. I don't know whether it was a new setting at school or whether it was down to vagus nerve treatment, but she was definitely a lot better. So I believe the vagus nerve treatment was much needed to help the deep and ingrained layers of stress leave my body and hers. The stress from her gets to me, and then it almost like gets fed back. So it's almost like it mirrors. But so you need to sort it from both sides. My psoriasis improved, which I'd got since after she was born. I hadn't had it before in my life, and it's the best it's been since then now. Stress has been allowed to dissipate from the vagus nerve system, and my immune system feels like it's gradually coming off high alert. I don't think it's not an overnight fix, but I'm definitely starting to feel better. I also, over the last few months, it feels like I've really let go of some grief from a long time ago, which I think when you're in a stress state, it's hard to do that, and it just wasn't really intending to, it just felt like it did. And I just feel like I'd have got an underlying feeling of lightness and calm and feeling brighter on another level to what I've ever had before. When I started reading about the vagus nerve and the polyvagal theory, over and over in my head I kept hearing never been safe, and I did have quite a traumatic time when I was a baby. My mum ended up in a mental hospital, and I had to go with her as a young child, and I doubt, not a young child, but as a newborn baby, and I doubt I was probably cared for and nurtured as much as I needed, and maybe that affected my vagus nerve. Hers wouldn't have been regulated, so what I'd have been picking up from her wouldn't have helped soothe me either. So I think I need to find my own ways to soothe, and yeah, it does feel different for me now, and I'm excited to see what happens next for my own health. So let's talk about the vagus nerve. So the vagus nerve is the 10th cranial nerve, CNX. It's also known as the wandering nerve, and it contains 75% of the parasympathetic nervous system's nerve fibres. The vagus nerve originates in the brainstem and makes its journey through the body, travelling down through the neck, chest, heart, lungs, abdomen and digestive tract. The vagus nerve has various significant roles. It supports our emotional well-being and helps to calm the body after stressful events by slowing the heart rate and calming the nervous system. It acts as the body's internal control system, allowing the brain to monitor and receive information about crucial bodily functions such as heart rate, digestion, breathing, immune response and mood. So a little bit more about the anatomy. So the pathway. The vagus nerve originates in the brainstem. Although we refer to the nerve as one, it's a pair of nerves that stem from the left and the right side of the medulla oblongata portion of the brain. Within the brain, the auricular branch, also known as the Arnold's nerve, arises. It exits the cranium through pathways in the jugular foramen. In the neck, the vagus nerve descends into the carotid sheath, flowing with the jugular vein and the common carotid artery. 3 branches arise in the neck, including the superior laryngeal nerve, the pharyngeal branches, and the right recurrent pharyngeal nerve. At the base of the neck, the right and the left vagus nerves branch into 2 pathways. The right vagus nerve passes anterior to the subclavian artery and posterior to the subclavian joint and then enters the thorax. The left vagus nerve passes between the left common carotid and the left subclavian arteries posterior to the sternoclavicular joint and then enters the thorax. In the thorax, the posterior vagal trunk is formed from the right vagus nerve and the anterior vagal trunk is formed from the left vagus nerve. The left recurrent laryngeal nerve and the cardiac branches arise in the thorax. Both vagus nerve trunks enter the abdomen through an opening in the diaphragm called the esophageal hiatus at the level of the T10 vertebrae. It is here that the anterior and posterior vagal trunks, also called gastric nerves, are formed. These trunks terminate by dividing into branches that supply the gastrointestinal tract, as far as the splenic flexure of the colon, according to current theories and studies. However, we have been feeling a lot of stuff further around, so our gentle release treatment goes all the way around the large intestine, down through the bowel, and also in the other way, we're going as far as the cervix because there are links with the cervix and the vagus nerve. So, the parasympathetic nervous system is a network of nerves that brings the body back into a state of rest and relaxation after dangerous, threatening or stressful events. The fibres of the parasympathetic nervous system include 4 cranial nerves. One of these is the vagus nerve, which makes up approximately 75% of the parasympathetic nervous system and some of the sacral spinal nerves. So when activated, the system allows the body to enter rest and digest mode. During this time, the body enters a state of relaxation, which encourages recovery. The heart rate slows, breathing slows and becomes deeper, blood pressure lowers and digestion is promoted. When the body is calm, safe and at rest, the parasympathetic nervous system can continuously regulate and control bodily functions such as the production of saliva and tears, sexual arousal, urination, defecation and digestion, and it allows the body to build and conserve energy that can be used later. So, for some of the functions of the vagus nerve. So, it gives sensation to the posterior part of the auditory canal and the external ear. It stimulates the muscles of the throat and the soft palate. It innervates muscles of the larynx, which alters our tone of voice. The cardiac branches regulate the heart rate at about 60 to 80 beats per minute, and if it wasn't for the vagus nerve, our heart rate would be a lot higher. The cardiac branches provide visceral sensation to the heart, so that allows us to feel what's going on in our heart. We also get a minor role in taste sensation. The parasympathetic innervation to most of our abdominal organs, so feeling what's going on down there as well, stimulates smooth muscle contraction and glandular secretions in abdominal organs. It increases the rate of gastric emptying and stimulates acid production. Now, I'm going off track a little bit here, but I think a lot of, you'll have heard a lot of women of, say they're supposed to be in their 40s, but younger as well, struggling with their gallbladder. Obviously, it's not just women, there are some men, and I think a lot of it's down to stress and the vagus nerve. So I'm very excited when we start seeing more clients with gallbladder problems to see if they can resolve if we support the vagus nerve. Senses information about the microbiome and transfers information to the central nervous system to generate a response. It has an anti-inflammatory pathway to calm peripheral inflammation and decrease intestinal permeability, so it's going to help things like leaky gut. There is a growing evidence that the microbiome can have a beneficial effect on mood and anxiety, partly by affecting the vagus nerve. And the knowledge about the bidirectional interactions between the microbiome and the brain are growing all the time. It's also involved in satiation after eating. Excessive activation of the vagus nerve can cause vasovagal syncope, otherwise known as fainting, due to a sudden drop in cardiac output. This is the most common cause of fainting, when the blood vessels open too wide or the heartbeat slows. Common triggers are the sight of blood or severe emotional distress. Prior to fainting, bodily responses would be lightheadedness, nausea and sweating. The cervical shock via the vagus nerve pathway can occur after cervical dilation for procedures such as IUD insertion, hence why we decided to include the cervix in our vagus nerve treatment. And obviously we don't actually touch the cervix, so don't worry about that. It's we do it from a distance. And yeah, very interesting that. So it also causes temporary loss of bladder control in moments of extreme fear. Orgasms have been also found to go from the uterus and cervix to the brain via the vagus nerve. It also controls glucose production in the liver, connected to the gag reflex, and also activation of the vagus nerve directly affects pancreatic, exocrine and endocrine secretion. So we're just going to give a very quick introduction to polyvagal theory. So polyvagal theory was created and developed by Dr. Stephen Porges. The theory helps us to understand how the nervous system, brain and body respond to stress and trauma. With this deeper level of understanding, we can see how the autonomic nervous system controls our responses to daily life and challenging situations. Polyvagal theory views the parasympathetic nervous system as being divided into two branches, the ventral vagal system and the dorsal vagal system. It also understands that both systems calm the body, however they do so in different ways. So the ventral vagal system supports social engagement and allows us to feel safe and relaxed. The ventral pathway connects to and serves areas above the diaphragm. The dorsal vagal system supports immobilization behavior such as shutdown. In addition to affecting the heart and lungs, the dorsal pathway connects to and serves the areas below the diaphragm. So remember, ventral is from the diaphragm up, dorsal the diaphragm down on the whole. So when viewing the parasympathetic nervous system through the lens of polyvagal theory, we can see it as ever-changing, with the ability to move between states of activation and calm. Polyvagal theory has three key principles: the autonomic ladder, neuroception, and co-regulation. It demonstrates that the nervous system has the ability to shift and move between three states: ventral vagal, sympathetic, and dorsal vagal. So the autonomic ladder. So the ventral vagal state is at the top of the ladder. This is the human's most evolutionary complex state of being, our social state. This is where we feel safe, grounded and calm. We feel happy, joyful and open to learning and new possibilities. This has been described as the state of the open heart, feeling close to and trusting of others. In the ventral vagal, we feel connected to others. We make eye contact, take in the faces of others and enjoy communication. Physically, when we're in this state, we can enter rest and digest. We feel more relaxed and our digestion, immune system and circulation are able to function well. This dampening and parasympathetic response takes place through the vagus nerve. So the sympathetic state is a fight or flight response. It's an activated state that mobilizes our energy. It gives us an increase in heart rate, temperature and perspiration. It can happen when we feel stressed, anxious, angry or triggered. The world does not feel safe. Physically, the blood is directed away from the digestive system towards the muscles and limbs, and the adrenal glands release the hormone cortisol. So the third state is the dorsal vagal state. This is the oldest, most primitive state, the shutdown and freeze response. So the sympathetic branch is overwhelmed by stimuli and or prolonged periods of stress or cannot resolve a threat or situation. The nervous system shuts the body down. We collapse, feeling hopeless, helpless and trapped. Heart rate, temperature, blood pressure and immune responses are lower. Pain is numbed. We feel exhausted and burnt out. With the knowledge of each state, we begin to understand how our body responds to the stress and trauma. By implementing the practice of hierarchy, the autonomic ladder, we can learn that we can move up and down the ladder. In doing so, we can only do so in sequence. For example, we can move from ventral vagal to sympathetic to dorsal vagal. Alternatively, we can move from dorsal vagal to sympathetic to ventral vagal. However, we cannot move from ventral vagal to dorsal vagal without moving through the sympathetic. This can explain why people who have been stuck in a dorsal vagal freeze response may find it difficult to move from this state of loneliness, depression, disassociation back to the safety and calm of the ventral vagal social response. They cannot jump from one place to the other. They must move through the sympathetic activated state. Although this may happen quickly, it can feel stressful and difficult. So, neuroception. This is the nervous system's built-in surveillance system. Functions below the subconscious, constantly scanning our environment, our body and other people around us for cues of danger and safety. The thinking part of the brain isn't even engaged. The nervous system shifts the state of our autonomic nervous system to optimize survival and respond to situations. Chronic stress, childhood trauma, or a history of adversity can lead to faulty neuroception, which is what makes it difficult to register cues of safety. And I would say that neuroception would have been off with my daughter when she was really struggling at school, and she would have been constantly scanning her environment and people around for cues of danger and safety. So in neuroception, we become hypervigilant, feeling jumpy or detecting low frequency noises such as cars on the road or thunder as cues of danger. Neuroception is heavily influenced by our resilience. Based on which nervous system state we are currently experiencing and our history of how flexible we are in moving between the states, our neuroception becomes biased. For example, if you are highly resilient, you are more likely to detect cues of safety rather than threat. On the other hand, if you're less resilient, neuroception will be biased towards detecting cues of threat and danger. Co-regulation. So co-regulation is vital to our well-being. From birth, we have a longing to connect with others, and as humans, we thrive in connection and community. Our drive to survive unconsciously sends us cues of safety and danger. Cues of safety are perceived as an invitation to connect with others and co-regulate. Cues of danger are recognised by the nervous system as a warning, telling us not to connect, to create space and distance. Our survival responses are reinforced. So the co-regulation is also how we experience our gut feelings about others. When we're able to co-regulate with another, our nervous system can be soothed during moments of dysregulation, allowing us to feel calm. A prime example of how crucial this is to our well-being is that no one is born with the ability to self-soothe. This is why babies and children need to co-regulate with a familiar caregiver. Repeated experiences of co-regulation from an adult with a regulated nervous system teaches children how to self-soothe and self-regulate. So this kind of feeds back to what I was saying about my birth. I doubt my mother was I mean, she was a fab mum, she really was. But when she was struggling, she wasn't going to be in a place to regulate herself, and then I wouldn't be able to pick up that regulation from her. So we've got the fight, flight, freeze, or fawn response. These are the physiological survival responses to stress, danger, threat, and harm. Each of these are trauma and stress responses that have their own unique characteristics. So the fight response is fueled by the sympathetic branch of the nervous system. It's when we feel we can overpower the threat. We respond to situations aggressively. This could be yelling, slamming doors, crying with anger, feeling out of control, dominating conversations. We feel an urge to punch, kick, or stomp. We appear hostile, irritated, and rageful. And actually, that's a response we see a lot in children that are struggling as well. Our heart rate increases, breathing becomes heavier and intense. We feel knots in our stomach, and the jaw may become tight and tense. This is usually our last resort, when the body sees the situation as something greater than the perceived ability to cope. Then we've got the flight response. This response is also fueled by the sympathetic branch. However, it is driven by fear. We enter the flight response when our brain thinks we can run, hide, or flee from danger. Responding through this state can also look like avoiding conflict, restlessness, fidgeting, ghosting people, ignoring or escaping situations as a coping mechanism. Physiologically, our heart rate increases, our pupils dilate, and we may experience numbness in the hands and feet. So the freeze response is activated and influenced by both the sympathetic branch and the dorsal vagal branch. It's fueled by fear. However, instead of running or fleeing, we enter a state of freeze and immobilization. Physiologically, we can feel cold, our heart rate decreases, our skin becomes pale, and we may feel stiff and heavy. Those who experience high levels of anxiety often find themselves in this state, and we may feel a sense of dread. It can look like disassociation, hypervigilance, procrastination, and remaining silent. Then we've got the fawn response. This is when fight, flight, or freeze fails. So we leave the sympathetic branch and enter full vagal dorsal shutdown. We avoid any and all conflict and instead try to pacify all threats. This is common for people who have experienced abusive childhoods and relationships. They're more likely to respond that way. When acting from our fawn response, we are more concerned with making others happy, even when this means putting their needs before our own. This can look like submissive behaviour, people-pleasing, denying our own feelings, being overly polite and helpful, finding it difficult to say no, and seeking approval of others. So, that's all I wanted to say, and hopefully given you a brief intro to the vagus nerve and polyvagal theory. So now we're going to talk about the vagal tone and heart rate variability. So heart rate variability, or HRV, is the variation in intervals between your heartbeats. When your vagal tone is high, your body copes better at moving out of stressful states into restored states. It's perfectly normal and healthy to have stressful times during your day, so long as your body can take you out of stress and calm you down. Vagal tone is the ability to switch between a stress state and a calm state. If your vagal tone is low, you can get stuck in a stress response, which can impact immunity, inflammation, hormones, digestion, cardiac health, mood, and depression. So measuring HRV can give an indication of how your body is balancing between the sympathetic, which is the fight or flight, and the parasympathetic, rest and digest. HRV is measured in milliseconds, and a normal range could be from below 20 to over 200. What's normal for you would depend on age, sex, physical fitness, and genetics. It's important we measure HRV only against our own baseline and don't compare it with others. A higher HRV would normally indicate good fitness and recovery, but can also be linked to better quality sleep. A lower HRV can be caused by overtraining, but also by stress or illness. So we can now track our own HRV and stress levels at home. So Aura rings, which is what I've got here. So it's a ring with, oh, where's the camera? With lots of gubbins inside. Some Garmin and some Apple Watches also measure HRV and stress. So HRV is calculated using RMSSD, which is the root mean square of successive differences between normal heartbeats. So first, calculating each successive time difference between heartbeats in milliseconds, the devices take measurements every 5 minutes while you sleep throughout the night to give you an average HRV, a max HRV and a trace HRV. So the trace is how it moves over time. So Garmin and Aura both use the HRV to measure stress levels during the day. I think Apple do as well, but there wasn't much information about the Apple HRV out there yet. And tracking your HRV and your stress can be a really useful comparison tool. So just to give you a bit of understanding, so this is Aura's key to stress levels. So at the top, it's probably roughly 25%, your body is experiencing signs of stress. It's common and normal, but it also serves as a sign to seek restorative time. Then probably between 50 and 75%, we've got engaged. Your body is showing some elevated signs of stress, but it can potentially be good for productivity or performance. And we've got relaxed. Your body has moved from a state of stress into one of mild recovery. And then recovery, your body is recharging in a state of pure calm. So on the graphs, it looks like recovery is about 0 to 25% and relaxed is 25 to 50. Then above 50, you go to engaged and then stressed. I've got a couple of charts that I can show you later on about our case studies, and you can see the charts that we've got on HRV. So benefits of stimulating the vagus nerve. So it can minimise seizures in epilepsy through a vagus nerve stimulator. I think that's probably the most clinically relevant thing that's happening with the vagus nerve at the moment. Stimulating the vagus nerve can also support anxiety and depression. It regulates emotions and improves mood, reduces blood pressure, regulates heart rate, and also promotes overall cardiac health. There was a really good medical paper about all the different areas that the vagus nerve could help in heart health, which was really interesting. It reduces inflammation, alleviates migraines and cluster headaches, improves digestion, reduces the body's response to stress, improves hormone health, and promotes healthy metabolism and digestion. So lots of different things there, and that actually covers probably a wide range of our clients, really. And then medical interest in the vagus nerve is absolutely massive. So these are just a small section of areas that I'm interested in and that will be following with great interest as we do more gentle release vagus nerve treatments. Basically, if there's anything you're interested in and whether it's connected to the vagus nerve, just put in the condition and vagus nerve in Google, and it's likely that lots of papers will pop up if it's connected. So these are the ones that there are things written about. So we've got cardiac health, perimenopause and menopause, low progesterone and infertility, because if your body's in the state of stress, the first thing to go is to shut down the fertility, because you don't want to be making babies when you're stressed. So really important for fertility that we can help our clients be calm. And then pass that calmness onto the baby that's coming. Because I'm going to come down to fetal development shortly. So they've found that babies in utero also take on the vagal tone of the mother. So we've got neurodiversity, autism, ADHD, there's papers about that, Alzheimer's, Parkinson's disease, epilepsy, long COVID, which has been connected to inflammation in the brain, psoriasis, lupus, endometriosis, other autoimmune conditions, obesity, and even cancer. they're saying that if you've got a higher HRV, you're more likely to live longer with cancer, or I guess be less likely to get it in the first place, which is so interesting. Lots of papers about that out there if you want to Google it, and many, many more. So I'm just going to tell you a little bit about the vagus nerve treatment protocol that we've created with gentle release therapy. So the vagus nerve stimulator that they're using in epilepsy is an electrical device that's inserted in the body. So I'm very holistic. I was like, let's see what we can do for our, in our treatment rooms to help ourselves without having to have something medically inserted. So gentle release is a really gentle touch therapy. It's intuitive and bespoke to each client and what they need on that day. Treatments are up to 2 hours for each of our vagus nerve protocols, and it involves energy work, gentle touch, and it can also be done as a virtual treatment. So if you're familiar with Reiki, it's a little bit similar to Reiki. Some people have said it's like Reiki on steroids, but it's that kind of energy work, but with much more specifics on where we're working. We have found that for the average client, about 4 treatments is enough to get us through all the vagus nerve areas I want to cover. So treatment 1, we just focus on the ventral. So if you remember when I talked about the ventral, that's from the diaphragm up. So we start at the back of the head, then we come down around the ear, down the neck, and work on the lungs. So we clear all of those areas and then we come back up. Treatment 2, we recap on the ventral areas, but come down into the dorsal, into the abdomen area, and then flow back up through the ventral because we don't want to leave anyone in that dorsal state. Treatment 3, we add in areas of the brain. So the treatment is more focused on the areas of the brain connected with the vagus nerve for treatment 3. And then we go back through the ventral, dorsal and ventral. So it's each recapping. And even though the treatments are still all going to be about 2 hours, the ventral gets quicker each time because we've already cleared the deeper stuff, and each time everything gets quicker so we can add in a bigger chunk. And then for treatment 4, we've got the HPA axis, which is massively important, working hand in hand with the brain and the vagus nerve to help us calm those cortisol levels. So treatment 4 focuses on the HPA axis. I mean, one of my clients, it did take 2 hours to do her HPA axis, but normally you do HPA and then over the brain again, and then back through ventral, dorsal, and back through ventral again to finish. So sometimes if someone is really, really stressed and maybe in shutdown, treatment 1 in the ventral, we might spend, say, the whole session and only get through 3 points, but I don't mind. That is what they need, that's what their body needs, and it just needs to be taken slowly. Whereas some people, if they're not so stressed, may get through all the ventral in that first session, no problem. So I've just got a couple of case studies to talk through. So this first case study 1 is a 27-year-old female. She has anxiety attacks, eczema, low energy, spotting through the menstrual cycle, and a short luteal phase of 8 days. So just for those that aren't familiar with luteal phases, that's the time from ovulation till the first day of your bleed. So normally that should be about 14 days. If it was about 12 days, that's probably okay, but anything lower than that could cause miscarriage because the progesterone isn't high enough to support pregnancy. So a luteal phase of 8 is really quite short. What else was I going to say? So this client uses the Aura Ring, and this chart here is from the Aura Ring. And as you can see, prior to the treatment, it was mainly engaged and stressed, and she only just dips into relaxed slightly in the morning there. So very much up and down between stressed and engaged. So following her vagus nerve treatment, I've then put the before and after there. So you can see after her treatment, she barely even touched the stressed area at the top, but has had 4 hours of restorative time down at the bottom. So it adds it up for you. So prior to the treatment, she had 4 hours and 30 minutes of her day in stressed, 15 minutes in restored, and after the treatment, 30 minutes in stressed and 4 hours in restored. So we were very excited to see those results. And it's really nice as a therapist to be able to see things like that. You know, we don't often get this kind of feedback from what we're doing. So obviously we can see great things from the results from her roaring, but what did that actually mean to her? So she has noticed her eczema has improved, she has better energy levels, she used to wake 4 or 5 times a night and now she's pretty much sleeping through. Her appetite's more regulated, so she used to not eat all day and then eat lots in the evening. Now she's eating more balanced throughout the day. Then her short luteal phase as 8 days has lengthened to 12 days, which is great. She used to bleed throughout her menstrual cycle, but she's now only spotting the day prior to her bleed, which is fantastic. So spotting before period is a sign of low progesterone, so it's showing not only that her luteal phase has lengthened, which would show that her progesterone is working better, but also the spotting has decreased dramatically as well. She has almost no anxiety attacks, and she previously would have had 2 to 4 times per week. She only had 1 anxiety attack when something extremely stressful has happened, and I'd say that has been for about the period of about 4 months. So that's really positive. So case study 2. This is a 45-year-old female with anxiety, high blood pressure, low energy, and poor sleep. So she said to me, anxiety is my main issue, but this can come and go to some degree, but I recently feel stuck in a permanently slightly stressed place, and I feel like I need a reset. So she'd read about what I was doing. She said, please, can I come and have the vagus nerve treatment? I said, yes, of course. So her most interesting results are the blood pressure, actually, which I'll tell you on the next slide. But I just wanted to show you her heart rate variability. So this is from an Apple Watch. So she's had 4 vagus nerve treatments. Started in January, then we did February, March, I think, and then probably later in April. But yeah, her last treatment, which was day 4, is shown on the chart there, day of vagus treatment 4. So that was when we included the HPA axis treatment, and she was the client that was doing that took 2 hours. So this was really interesting, and it actually showed on her chart a really good improvement in HRV following that treatment there. So the higher the heart rate variability, the more resilient we are, the more we cope with stress. So that beautifully went up following her treatment there. Then I just wanted to talk about her blood pressure trends. So in late 2023, her average was 128/96. So according to the NHS website, high blood pressure is considered to be 133/85 or higher if your reading was taken at home, and all her readings have been taken at home. So her top number is not too bad at 128, but her bottom number is high at 96. So we started the treatments in January, and then in February her average was 118/86, so both numbers coming down nicely. And actually she kept measuring it morning and night and kept sending me the figures, and it just dropped beautifully. And we probably spread the treatments out over maybe about 3 to 4 weeks per treatment. So even though it's a 2-hour treatment, you know, it's and it is expensive because it's a 2-hour treatment, it's actually you know, it's lasting for a good long time. And then early March it was 117/82. The week after 115/79. So it went back well into normal range at that point. And then she sent me a message to say, so it's still reducing as the weeks go on and staying down, yay! And then on the 22nd of April, Oh, and my blood pressure was 112/75 yesterday. So yeah, it's been so lovely to watch and see that change for her, because she tried a lot of advice, like she'd lost weight, she was trying to do more meditation, she was eating healthier, but yeah, nothing changed until she came to see me for the vagus nerve work. So what else? Here's another graph here on my next chart, which is, you can see the trend over time from December for a HRV, and then going up after that last HPA treatment. So I think the HPA treatment was the key to her HRV, but actually the vagus treatments in the meantime were helping her blood pressure. Maybe we had to get to the point where her body had got into back into homeostasis with the blood pressure, so that her body could recover, and then that HPA was just the icing on the cake. I should say she didn't want to go on medication for the blood pressure, so I didn't have to worry about that when I was treating her. So what has she noticed? So she says she's got increased energy, reduced anxiety, her blood pressure is much improved, and her sleep has much improved as well. So there are some issues with tracking data. I mean, it'd be fabulous if we could see the results from all our clients after we've given them treatments, but external life events can cause stress and affect data. Illness can affect HRV, and it's not always easy to get the client's data that you need. We don't necessarily have access to their apps. And also it'd be really useful to get a good few months of before data to allow us to observe their existing patterns and trends before you start trying to look how the treatments have affected them. So, and it also might not be good for clients that may get fixated or stressed about the results too. So you must be desperate to know how you can improve your own vagal tone. So there's a whole list of things, and if you Google, you'll find lots of things. But just briefly, we've got breath work, cold exposure. Now, interestingly, when I was really struggling before we got into the vagus nerve, I had started cold water swimming in a lake, and oh my God, it got me through. It really did. I really enjoyed it. But I do feel that you need to be in a good place to benefit from that fully. Like if you're in a stressed place, I don't know. I mean, it helps, but I don't know that it's the best thing. Exercise helps. Meditation and relaxation exercises can help. Also by improving your microbiome, eating lots of different vegetables to get the microbiome doing what they need to be doing. Laughter, gargling, humming, singing or listening to music, massage, interacting with others, nice people obviously, and also gentle release for the vagus nerve. So if you fancy trying out gentle release therapy for the vagus nerve, we've just say it's April 2024 started getting our first practitioners trained, so they'll be able to offer treatments in about 6 weeks or so, and we'll have a list on our website then. So if you're interested in receiving a treatment or if you want to train, I'll talk about that now. So if you're interested in gentle release therapy training, it's an opportunity to receive treatments for yourself and let go of your own stuff, and then you can take therapy back to your treatment room. So we offer our practitioner training in 2 ways. In total, it's 3.25 days, which you can either do on Zoom or in person. So it's £455 on Zoom. I tend to do it spread over 5 days to fit in school hours. That works really nicely actually. So it's normally 9:30 till 2:30, Monday to Friday. And basically over the week you get to give and receive 7 different treatments. And you may think, well, how am I going to give a treatment by distance? But honestly, it's amazing, and the feedback we get from people about what they've picked up and what they've felt is just mind-blowing, honestly. So you can do it on Zoom, or if you want to come in person, it's £645 for the course, plus if you want to stay over, £225 for dinner, bed and breakfast in retreat accommodation, and that's from Monday to Friday. There's a picture there of us in the barns and the lovely swim spa to go in, and it's everyone gets their own double ensuite room, and yeah, it's a lovely chance to get away and let go of your own stuff. So yeah, so it's the same course whether it's on Zoom or in person. In person, the course is Tuesday, Wednesday, Thursday, and it's full days, but we get together on Monday night to do the intros and get to know each other. Yeah, and it's only small groups, so 8 is my perfect number for courses, because then everyone gets to swap with everybody, not too big. We spend a lot of time doing the treatments and then feeding back on how it went. So anyway, you need to be a gentle release practitioner to do the gentle release vagus nerve training, because the vagus nerve treatment's very intuitive. You need to have learnt where you need to be going in the body, how to know if an area is clear or not, and so you need to do the practitioner training first, and then you can do the vagus nerve training, which we have made it as for 4 days, but they're shorter days, so it's only 5-hour days, 9:30 till 2:30, and we've spread them out, so it's about 3 weeks apart between each course, so that the treatment has got time to integrate. We do feel like it'll probably be too much to do it back to back, and that's £375 on Zoom. So just to recap, the vagus nerve, can it revolutionise well-being? Well, I think there is so much potential out there, and honestly, I might actually put a list of different papers that we've come across on the website if you're interested. I'll try and submit a link for that. Yeah, it just has so much potential, and if we, with our complementary therapies, can be supporting the vagus nerve, then that's going to be a win-win. It really is, not just for ourselves but for our clients and our families. Yeah, I'm very excited to see what's next, and it's very early on the beginning of the gentle release vagus nerve journey, but we are so excited with the results we've seen so far and looking forward to seeing what results we get in the future, and obviously doing as much to monitor and track those outcomes and results as we can. So that's all I have to say. Thank you very much for listening. I hope we've intrigued you about the vagus nerve and about how the vagus nerve is for your clients and how it can help them. And if you've got any questions, feel free to email me at hello@gentlereleasetherapy.com or have a look on the website www.gentlereleasetherapy.com. Thank you again. Goodbye.